Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Good morning, Amarillo, and welcome to another episode of A Snowball's Chance in Healthcare. I am Josh Butler, your host and president of Butler Benefits and Consulting. We are a local boutique healthcare consulting and brokerage firm, and A Snowball's Chance in Healthcare is all about sharing innovative strategies, innovative ideas, solutions to healthcare. One of the biggest problems that everybody faces in healthcare is the prices we pay in healthcare, and we talk very frequently about that. Mainly, we say this in the tagline that this show is about restoring hope in healthcare and how we do that through very unique plan designs for employers. And today, I'm real excited about my guest today. Mr. Adam Berkowitz is with me. He is the founder and CEO or president. You go by CEO or president, or what do you go by, Adam?
I don't like titles. You can call me the janitor if you want to. That's fine by me.
Some days I'm the janitor over at Butler Benefits too, so it's very true. Document shredder, you name it. I mean, we wear a lot of hats. But with an organization out of St. Louis, Missouri called Simpara HR, Adam is one of the most brightest, and he is a very innovative consultant. We do very similar work. Welcome, Adam, to A Snowball's Chance in Healthcare.
Thanks for having me, Josh. It's a pleasure.
Absolutely. Adam and I have become really good friends over the last couple of years. We're both involved pretty heavily with Health Rosetta and have been pretty much since the inception of Health Rosetta. And, Adam's doing a lot of really cool and innovative things out there in St. Louis. And so tell us a little bit about yourself, Adam, and a little bit about Sempara for the audience.
You got it. Well, our business is 6 years young. And we started this business kind of with the mindset that there wasn't the right value being delivered in the equation between benefit advisor, benefit broker, and the employer and employee population. And so we wanted to build a model from the ground up that supported this type of transformation in a very incumbent-driven industry, right? It's a very legacy industry. And so we wanted to kind of free ourselves from all the shackles that hold the industry back, build something modern, build something fresh, and really deliver to all of our key stakeholders, which is better healthcare for less, supporting our communities, and watching them grow and thrive economically.
Better healthcare for less. I think that a lot of companies, and talk a little bit about this, is that a lot of companies have given up hope that that's even possible, that you can control or that you could better manage or mitigate or much less reduce the cost of healthcare and health employee benefits, especially, or maybe you can, but it's going to come at a very high price tag. Usually, like, your benefits are a lot worse, your network's a lot smaller. So when you talk about flipping the script, right? How are you doing this? Mm-hmm. How are you doing this with employers?
What you just described is an unfortunate shame that is the mindset in the industry, and it's nobody's fault, right? I mean, this is 40 plus years of how things have always been done. And so we have to reteach and relearn these concepts. And frankly, it's not anything too complicated. It's applying sound business practices to your healthcare, the way you purchase healthcare and health insurance. These things are intrinsically related. And so, but that's the biggest hurdle we come up against in the market is, first of all, reteaching and re-educating the consumer and the buyer, because they've been doing it this way for such a long time. And so, but it's refreshing and it's exciting to say to employees, hey, you don't have deductibles anymore. You don't have copays anymore. This is how healthcare should be. You shouldn't have to avoid taking that medication because you can't afford that copay. These are real problems in our healthcare system. And the nice thing about what we do and what you do, Josh, is that we create an environment where everybody wins. It is not a zero-sum game in our world. Isn't that right?
That's very true. And my ears perked up a little bit when you said things like $0 deductibles and $0 copays. I want to read you a little blurb that I got this morning from an HR director.
Sure.
Not in Texas, not here in Amarillo, of course. This is very far out of state. But it comes from an HR director that she had received an email from an employee. And I just want to read it because I think that millions and millions of people, this is their reality. And it says, I was wondering about our insurance and if it would be staying the same or changing this year. I know that we have an HSA, which I like. However, the high deductible plan, not so great. I personally am using up my HSA for medications and follow-up testing. I have more testing to be done, and pending those results, possibly even more testing. I need a surgery, but I cannot possibly do it due to all the other testing and prescription drugs and affording the others with paying out all of my HSA just for tests. Really hoping for a decrease in deductible. Thanks for your time. I mean,
how about that?
This is reality. This is what we are seeing. It's reflected in data. It's reflected in our interactions with our clients. Families are struggling now more than ever to simply afford the care that they need. And so I know that at Sempara, I know you well enough, I can say this to the audience. Adam is doing similar work that we are doing to address the unit cost of healthcare, to remove this biggest barrier to good quality healthcare is lowering the price. And so this show, we do get pretty specific, Adam. Give us a couple of specific ways you're helping people lower the unit cost of healthcare. To a degree, you can literally offer a health plan with a $0 deductible. Yeah,
you got it. You're going to be surprised at how simple this is, Josh. And same with your audience, I hope. And let me start with this. When you put the patient at the center of this equation, of the health insurance and the healthcare equation, all of this just makes a lot of sense, right?
Sure.
When that is our singular focus, all of this just follows. And so you talk about unit cost of healthcare. So what we've done was, first of all, you got to recognize that there's a significant amount of waste, bureaucratic waste, bloat, just built into our existing infrastructure of healthcare and health insurance. And that's by buying through PPO networks. That's by buying off-the-shelf products from big insurance companies. So what we did is we're very fortunate in St. Louis. We have great healthcare in St. Louis and in the metropolitan area. There's 3 primary health systems that compete, and they all have about a third of the market. And so we approached each health system individually, and we had a simple value proposition. And that is, hey, if we sent our membership to you directly, okay, and not your competition, could we get a fair price? Would you agree to give us a price that makes sense, that's transparent, and based on reality, which is the unit cost of healthcare? Because now, as you know, Josh, unit cost of healthcare is finally transparent. We can find out this information: the cost of an MRI, the cost of a lab test, the cost of a level 2 ER visit. We know the data, and we know that the PPOs are marking it up 3 to 4 times on average in our market. Okay?
6 to 7 times in some markets. Yeah, absolutely.
Yeah, and it varies by service. We've seen services in St. Louis that can get up to 11 times that unit cost as the PPO discounted rate. Okay, I'm not talking about bill charges. I'm talking about the PPO discounted rate. And so in exchange for a fair price, we're cutting out all of that fat, all of that waste that is built into insurance plans that you know of and probably have today. Your United Healthcares, your Anthem Blue Crosses, your Cignas, they're all the same. I'm not picking on anybody here.
Right.
And so when we drive the unit cost of care down, the cost of insurance goes down. And so we create these pathways. We say, hey, Mr. and Mrs. Employee, if you choose to receive your health care at Mercy Health, for example, one of the largest healthcare systems, they're based in St. Louis as well, your health care is free because we have achieved an optimized unit price. you can still go wherever you want. If you want to go to one of the other hospital systems or one of the other physician groups associated with a different hospital, then you just have a copay or deductible. It's still covered, right? So we're giving people choice, and we're providing the incentive that if you choose wisely, then it's free.
That's right.
And behavior change in healthcare is very hard. We've been trying this for a long time, and I say the we is in the industry has been trying this for very long. It is very hard to do. Most people want choice. We've kind of gotten away from the HMO model. People want go wherever you want to go. Quality of healthcare, cost of healthcare, these things are not published. There's no menu when you walk into the hospital. Right. And so through benefit design, people understand free. Most people don't know what deductible means. Most people don't know what coinsurance means. They understand free. If you go here, it's free. You go anywhere else, it's your traditional, boring, gross, deductible copay health insurance plan. And, I'll tell you, 70 to 80% of all claims in our plans choose the free option.
Absolutely.
And everybody wins.
Absolutely.
Everybody wins.
Yeah, and I think that's well said. And when you talk about behavioral change, let's talk and shift a little bit and talk about corporate wellness programs. I mean, I think a lot of people have this. I mean, because in theory, this makes sense that if your people are healthier, they will have fewer medical claims. They'll take fewer prescriptions. They will. Right. Your plans will be less, right? And that, in theory, that makes sense. In reality, behavioral change takes a really long time, and so that's where we have a little bit different opinion than a lot of people have when it comes to wellness programs. What do you tell your clients if they come to you and say, hey, we need to implement a wellness program because that's how we're going to save a bunch of money in healthcare?
Well, the typical approach is to ask a bunch of questions. We want to understand what do they mean by a wellness program? What are they trying to achieve through a wellness program? Because in general, your typical employer-based wellness program consists of a few things. A health questionnaire that everyone has to fill out online, and you're disclosing all of your bad habits and all of your good habits, right? How often you sleep, how often you exercise, how often you smoke, all of these things. There's usually an annual lab draw, so you're getting your blood. And then there's some kind of education program around walking more, eating better, exercising more, sleeping better, right? And that's your typical wellness program. And by the way, these programs aren't cheap. But when you look at your data and you actually look at a claim set from any employer, you're going to see that 80 to 90% of your population uses very little healthcare.
It's true.
And so think about a program that's encouraging people to eat better, sleep better, and exercise more. 80 to 90% of your folks aren't spending any money right now on your health plan, or they're spending very little. A couple maintenance medications that are generics, a couple doctor visits a year. So what? All the claims are coming from a small subset of your population, and these are things like cancer, hemophilia, expensive medications that, like Crohn's and colitis, those biologic drugs.
Yep.
A wellness program is not going to address those things. But unit cost of care, quality from your provider, and the site of care, those things matter. And so it's no wonder that wellness programs really don't move the needle because, again, 80 to 90% of your folks really aren't spending all that money. And the folks that are, these wellness programs just don't address it, or they can't address it.
Yeah, and that's absolutely true.
We have to look at the underlying financial implications of the plan and how we're engineering these plans to reimburse for healthcare services and guide people to appropriateness of care.
Yeah. And the way you engineer these plans is it does require us to educate employees a whole lot differently. I think one of the biggest misnomers that we try to get people to overcome, and it's just a mindset, is, once I meet my deductible, then the insurance covers that. We have this thing in healthcare where we need to re-educate the public about who the true payers of healthcare are in this country, and it's employers, predominantly employers, and it is taxpayers, and it's employees, because Medicare is the largest third payer in the country, but that's funded by taxpayers. So that's us. We fund Medicare. Then if you're in a company,
I love what you're saying, and I'm going to challenge it further because I've been thinking about this a lot. And I'm going to, even though the employer on paper funds the majority of the healthcare claims and the dollars, that's employee compensation. Right? It can all be viewed into the same silo of employee compensation. And so at the end of the day, really, this is employee money. Employees are funding the entire thing. the entire system.
And
like you said, Medicare, Medicaid, TRICARE, Social Security, disability, right? They're funding the whole thing, whether they realize it or not.
Yeah, so I mean that's why we always kind of start with re-educating people is that in fact, just because you've met your deductible or just because your copay is $10 for a drug and the insurance company is paying the rest, well, if it's a self-funded employer, it's the employer paying the rest with employee money.
There is no insurance.
There is no insurance, right? So we have to really start to understand the finance mechanism in healthcare and health benefits, because I think that there's a big disconnect because for 50 years, the system, the status quo model has been purchase all the healthcare you want. Stay in your PPO network and you can spend as much as you want, but you're only going to be out $10. We need to look at the holistic picture and look at the total price tag, because it's like nobody would pay $25,000 for this cell phone. They just wouldn't. But what if your copay was only $100? A lot of people would pay a $100 copay and then never know that it's $25,000 on the back end. And so that's the problem that I see in healthcare, and that's where plans like what you're developing for employers in the St. Louis area, it's solving this problem, correct?
Sure, it is. And, all of this probably sounds to the viewer very complicated and complex. Understand that to the employee, the member who's enrolled on this plan, it's very simple. You get an ID card, you go wherever you want to go, but to the plans that like you and I designed, Josh, when you go to certain places, it's free. That's healthcare. That's taking care of people. Because how can people afford to pay the huge premiums that are coming out of their paycheck and then another couple $1,000s on top for their deductible? It doesn't make any sense. And that's been the strategy over the last 3-4 decades, right? When the premium goes up, you shift it to the employee. Well, it's not sustainable, and there's an end to that road. You just can't go beyond a certain deductible limit, right? The IRS has capped it now. So you have these ungodly $6,000-$7,000 deductibles, and then what? You're still going to get the 20% increase. You got to focus on the economics, the underlying cost of care, the appropriateness of care, the waste and the fat that's just built into the system. Trust when I say there's really low-hanging fruit, and this is not complicated to achieve. Yeah,
and I think some of the lowest hanging fruit, let's talk about that for a second. I found some of the lowest hanging fruit is pharmacy costs. Prescription drugs have just exploded in cost over the last several years. But what a lot of people don't know is that there are so many cost containment solutions and programs that are out there in the marketplace that in a traditional insurance model, you can't take advantage of them. But in the types of plans that you and I create, you can start to take advantage of these solutions that are in the marketplace, and you can incorporate those solutions, those cost containment strategies within a plan design. Now, a common question I get, Adam, is this sounds really complicated. Employers don't want complicated. They want simple. Blue Cross Blue Shield, Aetna, Humana, Cigna, that is what is beautiful about their products is they're very easy to purchase and they're very easy to roll out and administer for employees. What you're describing, it sounds extremely complicated. So talk to the HR manager, talk to the CFO, talk to the people, the companies about how it sounds complicated, but we are simplifying it through plans like High Plains Health Plan. That's the plan that we launched here in the Amarillo market, and how you're simplifying it in your market.
Sure. I always like to talk about comparing it to the current system, right? Purchasing a product, the transaction of buying insurance, your typical health insurance plan is a really simple process. It's right. You can pick off the menu of options from any insurance company in their insurance plan. But I would argue that from an employee perspective, it's not very simple, right? Most people, can't even afford their deductibles, but most people really don't even know what their deductible is or what that word means. Most people don't understand step therapy, prior authorization, all of this red tape that's built into their health plan today, PPO networks, all this stuff, right? There's so much jargon. We've really complicated how do patients see their doctor and get the care they need. It's that simple, right? And so the plans that we're building, the financial side is something that we work on with the CFOs, the executives of the firm. once we roll out a plan to employees, it's very simple. Here's your benefits. Here's where you can get free health care when you need it. And if you have any questions, here's who you call. And it's always one phone number and one email address, or you can call, text, however you want to access it. And it goes to our team, right? These are live people. They work for us. And these are kind of the shepherds guiding people through what is a very personal, scary, and often opaque healthcare system. And so there's going to be folks that want to just go on their day, see the doctors they go to the pharmacies they want to. And then there'll be other folks that say, no, I do need some help. Help me find the best surgeon for my knee surgery that I know I need, because I don't know who the best is. We can help find that. And not only that, when folks call us, the incentive to the employee is that care is now free. And so when folks engage, because that's the key, is we got to get them to engage, because they've never had to do that before.
But that's what
guide them through the system.
But that's what the financial incentive is for. They don't need to know. People don't care. They don't want to know all of the inner workings and the finance mechanism behind their benefits. Right. You said this earlier. They do understand this. They understand that if I go over there, I'm going to have a $5,000 deductible. But if I go over here, I'm going to have a $0 deductible. They understand that. And so all we have to really, because when you talk to people that, what do you want in a healthcare experience? Not a health insurance experience. What do you want? Like if you're facing a surgery, what do you want? We get a common answer almost every time. They want quality. They want a fair price. And they want to be able to have the peace of mind that they're not, going to a really, really bad. Who wants to go to the worst orthopedic surgeon in the country? Nobody does.
And how would you know?
How would you know? Exactly.
And, I love what's happening in popular culture, all the podcasts, all the TV shows about kind of the dark side of medicine and healthcare. And these are anecdotal, right? It is not representative of healthcare across the U.S., but these are real things, right? Patients chose to go to these Dr. Death, right? And they had no idea. They had no idea. And so,
and that's the problem.
How
we
do
covered.
We demystify this process and be a guide. And part of how we achieve that is through doctor-patient relationships. Josh, I know you're really involved and proponent of value-based primary care. I mean, that's a huge core component. People trust their doctors. So how do you build in really, really good primary care as a foundation in a healthcare plan, and let the doctor be the guide, because the doctor understands how our plans work. The doctor understands the quality and the cost of healthcare in these types of plan arrangements.
Well, that's where I'm seeing a whole lot of
really powerful.
That's where I'm seeing a whole lot of cooperation and collaboration is in the primary care space. Is that because of the insurance model, primary care physicians have been affected more than anybody. They're not allowed because of the volume and the way they have to get paid. It's called fee for service, and they make more money based off volume of services. That's why they have huge, massive panels, and the wait time to get into your PCP could be a couple of days. You're going to get there, and you're going to wait in the lobby for 45 minutes before you see the doc. And then once you get in, you're not going to have very much face-to-face time with your doctor. So what we're finding is when you can solve this issue and these physicians understand our plans, it allows them to practice more at the top of their license and really focus on quality care. So our plans, we see this in the data, our plans typically do increase spend on primary care. But when we see the ER utilization, the inpatient utilization, the diagnostic imaging utilization, prescription drug adherence, all these other high-cost ticket items are going down, and this is how we're saving employers money. If you guys are just joining us, it's right. We're getting pretty close to the end of the episode here. This is a Snowball's Chance in Healthcare. Today I've been talking with Adam Berkowitz, my buddy, my pal, and my colleague from St. Louis. He is the CEO and founder. You said you don't like titles, but you used one a minute ago, and it was Shepherd. I love it. Last words, Adam. We got about 60 seconds left. Tell me one thing that if you were talking to an employer right now in 60 seconds or less, what's the number one thing they can do today to start to get on this path to impact their healthcare costs?
It starts with education. We're at a moment in history where the economy is really tight. Finding key talent is really hard. Inflation is up, and employees are nervous. This can be the key to competitiveness and longevity, sustainability, and profitability for everybody in the organization. So
Educate yourself. That's right. Talk to people like Adam Berkowitz. Follow him on LinkedIn. He's online at SemparaHR.com. You can find him there. But that's going to do it for this week, ladies and gentlemen. Thank you for tuning in. I am Josh Butler, president of Butler Benefits and Consulting, and each week we are having guests and we're solving problems and we're sharing information with employers and families alike to give you a snowball's chance in healthcare. Y'all have a happy 4th of July.
Here to
Adam,
give you a
thanks so
snowball's
much.
chance
Happy
in
4th of
healthcare.
July, buddy.
Thanks for having me, Josh.
You bet. See ya.